I want you to imagine a Boeing 727 crashing every other day for an entire year. Imagine how you'd react. Imagine how your community might react. That is the opioid epidemic. The most recent numbers, 33,000 deaths in 2015. 33,000. And despite the fact that our state, federal, and local governments are rallying around and trying to find solutions, experts believe that that number could triple over the next 10 years. That's a Boeing 727 crashing every day for 500 days in a row. What if you could create a vision for your community where you could build a solution around this issue? What if you could bring the right experts within your community around the table and the right resources to bear? And what if that solution ultimately saved some of your citizens' lives? Our greatest challenges are going to be solved by multi-sector collaborations. And I believe elected officials, especially at the county level, will be leading that effort. My own experience with multi-sector collaborations really stems from my work both in the public and the private sector. I've worked at the federal, state, and local level. I started my career as a federal agent. I've worked as a local county prosecutor, and I ran a state agency. On the private sector side, I was an attorney for 10 years, representing a wide range of business interests, and I've spent the last 10 years at United Healthcare. And for about the last 4.5 years, I've been a senior fellow at the University of Pennsylvania's Fels Institute of Government, studying in part this idea of multi-sector collaborations. And I believe that our greatest challenges will be solved by these multi-sector collaborations, because no one sector can do it alone. Now, this is not a new idea. I remember it first began to take shape for me back in 2005 when I was running that state agency. And I read a book called Governing by Network. It was authored by Steve Goldsmith and Bill Eggers. Steve Goldsmith, as you may know, the former mayor of Indianapolis, deputy mayor of New York, is now at Harvard. Bill Eggers, who was at Deloitte, has spent his career studying multi-sector collaboration. And it stood for the simple proposition that we can't solve complex horizontal problems with vertical solutions. We can't solve complex horizontal problems with vertical solutions. In other words, no one sector alone can do this. And they described in their book these networks that could come together across public, private, nonprofit, academia, and very complex governance structures to try and tackle these real challenges that government is facing. We've come a long way. Today we're using terms like public-private partnerships. We're using terms like cross-sector partnerships and collaborations, multi-sector collaborations, and there's more structure and more definition to it. We've made some real progress in funding models. You've heard of social impact bonds and pay for success. I think if you're a Democrat, you like calling it a social impact bond, and if you're a Republican, you like calling it pay for success. But they're by and large the same thing, and they have helped fuel the growth of these collaborations. We're more sophisticated, we're doing more, but we need to do much more. And why? Because these kinds of collaborations is what's going to solve our most complex problems. Now, what can you do to promote and prepare for what I like to call this new era of public-private interdependence? It means something maybe different to the business community than it does to the government, than to the nonprofit. Let me start by talking to the members of the business community, if I can. Northwestern University, their business program's called the Kellogg School of Management. It's a top program, maybe you've heard of it. The dean there believes so much that in order to be successful in business, you need to understand government. So if you're going to have an MBA from Kellogg, you need to understand how government works, because she believes that whether you sell to government or you are partnering with government or whether you are regulated by government, you need to have that as a core competency as part of your MBA. Let me read just a short piece of an article she wrote to get that point across. So what does this new era of public-private interdependence mean for business? It means learning to understand and respect the different priorities and structures that guide governmental hierarchies and policymaking, the different motivations, incentives, and power bases that characterize political actors, their administrators, and staff, the different ways of communicating and making decisions, ways that frequently operate on a very different timescale. Finally, it means understanding different views of a successful outcome. She offers the example, profits for business versus rising tide that lifts many boats for government. She concludes the piece this way: success in the 21st century global marketplace demands understanding the interdependencies that bind the public and private sectors, and cultivating leaders who can manage and partner across these sectors. So that's what it means for business. What does it mean for government? I would say it means pretty much the same thing, but it requires government to understand the incentives and the motivations and the structure and the challenges that the private sector faces. Let me quote, if I can, Stephen Goldsmith again, who wrote this in a 2014 piece around public-private partnerships. He wrote, in advising a major US city, a senior official once stated that, quote, a contractor is nothing more than someone trying to get money out of the government's wallet. So if that's the mindset that you're bringing from government to this collaboration, to this partnership, it's already failed. It's already failed. We need to understand the strengths and weaknesses that the government brings versus the private sector versus nonprofit versus faith-based communities that may need to play a role versus philanthropic organizations. So every sector has its strengths and weaknesses, right? Let's look at government. Government is very good at setting public policy. But public policy really needs to be driven by good data and good data analytics. Government struggles with that. They're awash with data, but they don't have the tools or the resources to analyze it and use it. That's where the private sector has many tools. Did you know that Walgreens can generally figure out a flu epidemic is breaking out about 2 weeks before the CDC, because they can monitor the sales in their stores that quickly? Orange County's coroner's office is the first one to really understand what was the cause of that opioid overdose. They know a lot about the victim, they know a lot about the cause of death, but they partner with Esri to really analyze it and then give that information to the public health department. For example, 90% of women die from overdoses by pills, and 90% of men by injections. That can be used to better target the communities and better do prevention from a public health perspective. We at United Healthcare and Optum can tell you by zip code what the disease states are and what's driving your healthcare costs within your population to allow you to be very targeted with your strategies. What we can't do is public policy. We need you to lead in that regard. So for example, when Massachusetts wanted to create a data warehouse to be able to share information across sectors around the opioid epidemic, they obviously had privacy challenges, which are inherent whenever you try and tackle one of these large problems. So it took, check my notes here, 9 academic institutions, 4 private, and 11 government agencies to be able to come together and build that data warehouse and manage up front the privacy issues that would have otherwise prevented that data sharing opportunity. Another good example is the way Narcan can now be distributed. Narcan, as you may know, is that drug. It's the spray that if someone has an overdose, it can be immediately applied and bring them back. And of course, we want our hospitals to have it, and our EMS and our police to have it. But it used to be where you had to have a prescription to get it. Well, there might be a mom and dad out there whose child is struggling with opioids. And they need that Narcan if their child were to have an overdose and they needed to revive them. So Government took the lead in support with private sector, and we've now changed the law in 46 out of the 50 states where you can get that more easily, so mom and dad can have that life-saving drug. Let's talk about nonprofits. They have a network already in the communities. Faith-based churches are right there in the community and are a phenomenal network to deliver some of these messaging and some of these solutions. I love the example of the Ocean County, New Jersey prosecutor's office. As I said, I used to be a prosecutor, and they realized that we can't arrest our way out of the opioid addiction, and we can't prosecute our way out of it. So they reached out to local hospitals, and when there was an overdose, they created at that moment an intervention with a local nonprofit that got them part of a recovery path. I can tell you, when I was a prosecutor, all we did was prosecute the case, dispose of it, and move on. But this prosecutor's office reached out to a private hospital and through a nonprofit and are tackling it in an entirely different way. Even industry is in the community in a way that can be leveraged. Walgreens has hundreds of drop boxes where not just opioids, but any kind of prescription can be taken out of the marketplace. CVS has pharmacists who are out educating youth about the dangers of opioids. No one sector can do it alone. We have to create these kinds of collaborations. So how do you build them? Today we're not going to talk about every kind of public-private partnership, and I know I'm highlighting opioids today. We're here in Ohio, so I think it's appropriate. This is unfortunately the epicenter of the epidemic. It's going to look different for infrastructure versus education versus criminal justice reform versus some kind of healthcare reform. But in my time today, I want to focus on, I think, the most important part of your strategy. And that is to get the right people on the bus. Get the right people on the bus. What do I mean by that? I'm stealing that analogy from Jim Collins. He has a book called Good to Great. And he studied great companies that had been great over a sustained period of time, and they looked at what are the characteristics of those great companies. And what he found was that early on, leadership got the right people on the bus, in the right seats, made sure they were all there as part of that leadership effort before they began to drive the bus, before they began to drive the strategy. Mr. Collins calls it first who, then what. First who, then what. And this is why I think the elected official is the most important person on that bus. Because I think you all play three very, very critical roles: convener, champion, and catalyst. Now, I'm taking these three roles from some research that the Brookings Institute did, and they did it in the context of building innovation districts, but I believe the research has equal application in the area of multi-sector collaborations. Let me describe what each of those roles are. First, convener. I mean, this is your natural role. This is in your DNA. This is why you're an elected official. You're very comfortable reaching out to the business community and reaching out to academia and nonprofits, reaching out to faith-based communities, reaching out to local chambers and building those coalitions. You are in the perfect role to begin to bring them together and bring them on the bus. Now, the research tells us that this is an area where sometimes these fail. This isn't just about gathering them together for a meeting. This is this early process is so critical to the long-term success. This is where you all have to go out and start having those one-on-ones and listening for those interdependencies. Just like a Kellogg MBA student has to think more carefully about the challenges of government, you in government have to spend the time to think more carefully about the nonprofit or about the private firm. The interests of a hospital system versus a payer are very, very different, even though they're in healthcare. That's where these things fail, but you all have the ability to start that process and be the convener. Second, the champion. Again, as elected officials, you're used to creating a vision, where you want your community to go 3, 5, 10 years from now, and then the leadership to help take them there. The other part of it is, I think, as the champion for this, you don't have to be the subject matter expert in education and healthcare. You can't. But what makes this especially complex is that you're bringing multiple institutions all on the bus. They come from different sectors, therefore different cultures. You've got to be the champion that breaks down those silos. Bill Leidy, former chief of staff to Governor Kane and Warner, used to coin the phrase this way. He said you have to change silos into cylinders of excellence. Silos, some cylinders of excellence. And I like it because it fits with the bus analogy, right? It's like an engine getting all pistons moving together before you can move that bus. So convener, champion, and then finally catalyst. You are the most important person in terms of your ability to remove legal barriers, legislative barriers. Let's face it, these problems are going to be fixed through strong public policy with the support of the private sector. And as a catalyst, you're in a position to do that. You're also the one that, quite frankly, brought these people on the bus, and you've got the trust. If there's nothing else you remember about about my talk today, it's this: collaboration moves at the speed of trust. Collaboration moves at the speed of trust. And if you don't build that trust, and you're the one that have built those relationships, that's what's going to be most critical. Let me wrap up today by saying some action items, if I can, as you leave today. And hopefully this has gotten you to think, I have to think differently about how I'm going to approach some of these really, really most difficult challenges. First, I want to give you a resource. The Intersector Project is an organization you can go to. They work with practitioners across all sectors. They have tremendous resources. They have case studies, they have toolkits, they have an interactive library where you can put in your location, you can put in the issue you care about. Neil Brito is the executive director. Tell him I sent you, call him, he will be helpful. But when you go back to your county, 3 things. One, you don't have to start from scratch. If you go to your staff and you ask them to sort of audit existing programs that they're doing, I think what you'll find is that they'll identify nonprofits in the community or other organizations, and they know that they touch the issue, but they don't know who they are, they don't know what they're doing. Don't start from scratch, build on those. Begin to build those relationships in that regard. Second, if there's an issue that you don't have some existing programming and you know it's an issue that's facing your community, you need to just go start having lots of cups of coffee. Reach out to people in the nonprofit sector. Go to your local academic institution. Reach out to private sector firms and start to understand those interdependencies. Right? Listen for what their issues and their challenges are and begin to build that coalition that ultimately is going to be the group that you're going to want to bring on the bus. And then third, start small. You don't need a big yellow school bus. A little minibus is just fine. Pick an issue. Again, I love the example of the prosecutor's office. That is simply the prosecutor's office with some local hospitals and one nonprofit. And yet they are literally saving lives by just thinking creatively about a multi-sector collaboration. Our greatest challenges are not going to be tackled by one sector alone. It is going to require a new era of public-private interdependence. Don't get left behind. Thank you very much. I think we have a little time if anyone has any questions or if anyone